In studio with the spotlight with Sarah Lucero.
Well, thank you, Lorena. We are Dos Latinas, and we are so excited to be here with you today with a fabulous guest. You're going to love to meet Dr. Rhonda Gottlieb. She is with the University of the Incarnate Word and a recipient of the San Antonio Nursing Consortium's award. Congratulations, and thank you for being with us.
Thank you so much for having me.
So, doctor, I want to know how did you feel and what was the first reaction when you got nominated and won?
I was so honored and humbled to win this award from the San Antonio Nursing Consortium. I've worked with many nurses that have been mentors, co-workers, and teachers that are outstanding nurses and very well deserving of this award. And so I was humbled to be honored with this award.
And this was a big choice because they had over 250 nurses that were a part of this, and only 25 nurses got selected. So, I mean, 2020 was a challenge year. And so what an honor that you are one of the winners, doctor. So
Tell us why you won. What did you do? What was your program? What did it do for the community?
Okay, so I am the Director of Clinical Health at the University of the Incarnate Word and also a family nurse practitioner. And we were tasked with creating a program to safely bring students and employees back to the university in order to combat COVID-19. So what we did is we developed a robust program that included work within UIW administrators as well as local health authorities, and created a robust testing plan, instant contact tracing. We had on-site quarantine and isolation rooms. We also developed a mental health program that could easily help and adapt to the students' needs that were dealing with COVID-19. And we were successful at maintaining our COVID-19 positivity rate on campus below 1% for the entire year.
So I want to know, doctor, how did that change your life?
Oh, it's been an amazing experience. It's been a struggle as well. The platform of COVID-19 changes daily, so we're always learning, but it's been a very empowering experience. Most recently, the University of Incarnate Word acquired COVID-19 vaccines, and we were able to vaccinate our students, employees, and their family and friends that qualified to receive the vaccine. And during this event, I had the opportunity to speak with people who had lack of access to the vaccine and had been living their lives in fear of going out in public. And so many of them had also had stories of lost loved ones and lost friends. So the fact that we're able to give a little bit of hope to the community and also provide education on what the vaccine will do for our community in the future.
What kind of feedback did you get from the students about your program and how it worked and how it helped them? Because students were really impacted. It was hard. It was hard on kids to go to school the way they had to last year. So what was some of the reactions or feedback you got?
So that's correct. At the beginning, there was a lot of fear, a lot of lack of understanding. So at the beginning, we really promoted healthcare education and literacy and provided these open-ended sessions where we met with students and their parents, the entire medical team, as well as the administration team, to make sure we understood their concerns and answered any questions they had. And now it's interesting because we've now been at this an entire year. And so these students now can quote to you the guidelines, the rules on how to keep each other safe. And they also held each other accountable. So we're very proud of our student population.
So it has been an entire education for everybody.
It has. This disease is new. So we've really learned about it over the past year. And the guidelines change from one day to the next. They're always changing. And we're always trying to adapt with the focus of maintaining safety and health within the community.
You know, like many doctors have said, 2021 is the year of hope. It's the year of a new light, and everybody must move forward. And thanks to the vaccine, everybody's getting at least that comfort zone now. Right. So, doctor, I want to ask some questions because there has been questions asked to me now that we do so many interviews. Sure. So what has been your feedback with some of the students with this vaccine?
So there's absolutely some vaccine hesitancy, which I think we're seeing across the nation, that many people are afraid because it is a new vaccine and also uses new technology. But it's a good reminder that the FDA did use the same process that they have with all vaccines. And it's been widely tested. I myself am a vaccine recipient, as well as everyone that works within our clinic. And so what we do is we just try to help them understand what it could mean for them to be protected. That sometimes it's not just about protecting yourself, especially when you're young and you're unlikely to have the adverse outcomes, but it may prevent you from passing it along to your mother, your brother, or your grandparents. And the students have been very receptive, and we will continue to work on that throughout the year.
What's going to be new and different for the nursing program that you're in charge of, the university, how things work, how they operate, your services? What's new in 2021 and beyond in the fall?
So in the fall, we've learned so much from having COVID-19. So we've expanded our services to include telemedicine in a full capacity that we hadn't previously had. But we also will continue to promote health and wellness, but also prevention. I think that COVID-19 has been an intense year, and what we really need to do is pause and look at the lessons we've learned and how can we use those in the future to prevent any similar scenarios. So in 2021, what we plan to do at the University of the Incarnate Word is look at this past year and really pause and evaluate the lessons we've learned. It's taught us so many things. Obviously, you've got the pandemic, but we've also learned about scenarios where students have suffered from mental health issues. These have been exaggerated because of the pandemic. And so we really intend to pause, learn from our lessons, and then go forward with helping to promote prevention so that we can eventually improve the outcomes of healthcare.
And it has been the biggest challenge because, like you said, doctor, people have had other issues, just staying at home, depression. I mean, I've heard so much of that, of people just going into this little kind of a zone where they're scared and they're terrified and they're panicked. I mean, I've known people that they're still today in quarantine, will not want to leave their house because they're in that panic. So I really do feel very relieved, Sara, that we do have the vaccine now, that it is making a difference, that people are getting educated, especially with help like doctors, to say, hey, it's okay, come and get vaccine, you're going to be okay. Now, another question I have for you. So I've heard that the vaccine is only good for 3 months.
So at this point, the CDC did release guidelines that allow us to avoid having to quarantine if we've had contact with someone who is positive for 3 months after their second dose of their vaccine, or their one dose if it's the Janssen vaccine. But we anticipate that as they learn more, that date will extend. And we're looking forward to that. So if we think about it, the vaccines really came out in the US in December. And so as they learn more, we hope that they'll learn that the vaccine protects us for longer periods of time.
That's wonderful. That's wonderful. So that's a great answer coming from a wonderful doctor that is right in the middle of all of this, that's been getting educated on a daily basis. And like you said, doctor, earlier, this has been new for everybody and we're all learning as we go. The biggest advice to everybody is you are not alone, and doctors like our doctor right here today are right here to answer questions for you. Sarah, what do you think?
I think that it's been really helpful to talk to you and to hear what universities are going through, how the students have been dealing with this, because it's good to know that there are services available to them and have been for the past year to help them deal with, the mental, emotional stresses of dealing with an unknown. I mean, it's been a huge unknown for all of us. So especially for our young people, I have a 22-year-old and a 20-year-old who went through their own, series of sadness or depression, questioning what's the future, fear, and they need answers. So we appreciate that you are there to provide some of those services for them.
Well, thank you.
All right, so doctor, I want you to tell everybody, how are you moving forward for the rest of 2021, especially being one of the winners?
So going forward, I hope to just continue to promote health and wellness and have the ability to reach out to the community. We do hope and anticipate that the COVID-19 vaccines will be more readily available in the next couple of months. And our goal will be to vaccinate as many people as we possibly can, as well as providing support for those that need it.
That's wonderful, Sarah.
Well, congratulations on your award. We can see why you were one of the recipients. Only 25 nurses out of the San Antonio Nursing Consortium received this award, and Dr. Gottlieb is one of them. So well deserved, and congratulations on your work. Congratulations on the award.
Thank you so much. I really appreciate it.
Doctor, thank you for being right here at Dos Latinas. And for everyone out there, any questions, any answers that you're looking for, Doctor right here can answer them for you. And how can people get in contact with you, Doctor?
So at the University of the Incarnate Word, through health services, we are easily accessible, and we generally treat and take care of students and employees on campus, but are happy to answer any questions that might be needed.
Information's for you right here. Thank you so much, Doctor, for coming to Bonita Production Studio. And thank you for following Dos Latinas. Hasta la vista.